to support our local communities that are affected by COVID-19. We're working on the shape and scope of that. If you mobilize a physician who's actually working on this now in their community, probably not the right thing to take them out of that fight. So we're going to look to see where are the folks located now who could offer help. And it's not just physicians. They have nurses, they have medics, they have a lot of other people who really could help us. And we think that if we have National Guard support, that they could help augment medical staff shortages, potentially could help expand testing resources, and even potentially setting up a field medical clinics if that were needed to be the case. So it's been, if you look at the last few days, you have sporting events canceled, all this stuff. I think that it's something that is, people are erring on the side of caution in the private sector, government organizations, and I understand that and think that makes a lot of sense in many respects. But I also think that this is something that we'll be able to get through. We're going to have to do this for the foreseeable future, but it's something I think that the people of Florida will be able to get through. So I know it's frustrating to see an event canceled or to see some of the inconveniences, but I think that everyone wants to, up and down the state, the local officials I talked to, the medical professionals, the private businesses, they want a healthy environment in Florida, and so we want to do our best to make sure that this virus is not allowed to simply run unchecked throughout our society. If you want more information, our website is floridahealth.gov. It's got the updated guidance on COVID-19, and I want to thank the Surgeon General. I don't think he's rested very much over the last however many weeks and months, and we appreciate his help. So I'm going to let him say a few words, and then I'm happy to take some questions.
Thank you, Governor. Good afternoon, everybody. First, I want to begin by thanking the Governor, Lieutenant Governor, for their incredible support and guidance in this response, and also fellow agency directors. This is a massive response that is involving thousands of individuals. Again, COVID-19, this is a new virus that has recently appeared. The spread is person to person, which is why we have precautions in terms of covering your cough and some of the other measures we talked about. This is like the flu, but is slightly different than flu in terms of symptoms. The most common symptom is fever followed by a dry cough and then associated with fatigue. As the governor mentioned, most of the cases that we are seeing in Florida are related to travel internationally or to areas in the United States where we are currently having outbreaks. This is why it is very important that if you come to Florida from an international destination or a part of the United States where there is an outbreak, that you take precautions while you are here. You need to very carefully monitor your symptoms. If you become ill, you need to contact your physician or the health department to let you know. Avoid going out in large groups and avoid having contact with individuals who are especially vulnerable, such as the elderly or individuals with underlying medical conditions. The incubation for this can be up to 14 days. So if you're returning from high outbreak areas, please be cautious. In terms of where the cases we are seeing in Florida, they are coming from different areas. We have individuals from New York now. This is an area where there are some areas of community spread. Egypt, Italy, Dominican Republic, Belgium, Trinidad, and also Ireland. As the governor mentioned, that we have increased testing capability, which is very important. This testing can be taken in terms of what the test means by your physician. Your physician will place a nasal swab in your nose and on the back of your throat. Sometimes they may all have you spit into a cup, and these samples will be tested. This testing can be done at commercially available laboratories, as the governor mentioned. The specimens, though, are not collected at the laboratories, but rather at the practitioner's office. Hospitals also may have testing laboratories where these can be attained. As the governor mentioned, the state of Florida has purchased 2,500 kits, which give tremendous capabilities, and we encourage hospitals that are CLIA certified, that have capabilities for molecular diagnostics, to participate in this. Also, in terms of medical providers, we have given medical providers information and we'll be writing more about this. So in terms of what can we all do? COVID-19, as the governor mentioned, is being seen in many states across the country, and we need to protect ourselves for the eventuality that the number of cases will continue to rise. Practice social distancing. Avoid going to work when you're sick. If you're coughing, cover your cough. In terms of hospitals, again, wish to emphasize that hospitals continue to review their infection control practices, make sure that your workforce is protected as we're dealing with individuals who will have COVID-19. In terms of what our goals are, first, we are working to contain the spread of the virus. So if we have identified individuals who have COVID-19, we will identify the contacts of these individuals, and so these individuals will be asked to self-isolate. This way we can break the spread and chain of transmission. And I really want to acknowledge the incredible activities of the members of the Department of Health, particularly the epidemiology teams and all the other individuals who are involved, who are doing this very complicated and important process of contact tracing so we can do this. When we get to situations where we end up seeing isolated cases in the community, then we'll go to broader measures. So at this point, again, I want to thank the governor and the rest of the state agencies for their incredible response to COVID-19. Thank you.
Governor, is there community spread of coronavirus in Florida now?
I'll let Scott handle what the latest epidemiology is on these cases. Oh, Dr. Rivers.
Good question. So right now, what we're seeing is we're able to take these cases from the investigation and identify where they are. Right now, we do not have evidence of community spread. However, investigations are underway to trace the cases back.
Governor, you were with Mayor DeSantis yesterday. Have investigators tracked back his contacts and whether he or not was in contact with Mayor Flores?
So I was told I was at minimal risk because I've stopped shaking hands and doing any of that. So I'm not getting in situations where, I'm just glad handing and then all of a sudden they say, hey, this person was here or there, and then I'm in a position where I have to self-isolate. So I've been kind of keeping a cocoon around me. I am not in any way concerned about my health in terms of contracting this virus. I don't think it represents a threat to someone like me, but I do not want to be somebody who is put out as governor for that. So we've been taking some of those measures, and that's just the way it's going to be. And so, but we were told, no risk on this given the circumstances. And I know they're looking at Mayor Jimenez, but there's nothing that would suggest that he's positive at this time.
Have you been tested?
Nope.
And you were on swabs for to test people. Where are you at with getting?
So a lot of these labs do have some. We also were able to, Jared Moskowitz was able to procure an order. So we're going to have a lot coming in, and they're scheduled to be here in 2 weeks. But we think that given where some of the existing supplies in the labs, that the test kits that we're sending will be useful. But clearly, if you get a real spike, we wanted to make sure that we had more of the ability to collect the sample. And that doesn't have that. This is just the testing kit, not the part for the sample.
Mayor Lenny Curry expressed frustration last night on Twitter that he feels like he was finding out information via the news rather than being told. I don't know if you have a response to that.
I didn't see what he said. I mean, what the Department of Health is doing, I told them, is as this information comes in, as soon as you have the facts and it's verified, push it out to the public. I think that for them to hold it and call this person or that person, I think it ends up making it more difficult. I'd rather get the information out to the public, let the folks know, what the latest is. So they're getting this stuff sometimes late at night, packaging it and turning it around very quickly. And I just think that's the best way to do it, to try to hold it and to do some other stuff. I think we just got to get it out. So that's what I've told them to do, and they're working very quickly to turn the information around. I would also say, and they're going to continue to do that, and I think it's important, but it's also the case that this number, that number, I mean, it's important, but the things that people need to be doing are true whether you have positive case in your county tomorrow, 2 cases, or not. The hygiene, the social distancing, particularly looking out for elderly people and people with underlying medical conditions and making sure they're not being put in situations where they can be exposed. And so we definitely want to continue stressing that. Yes, ma'am.
The Senate
Yeah, no, I'm glad. I'm glad it happened. I mean, obviously, we need it to happen. He's been working nonstop on this, and we need to, we need to keep going forward. So I thank the Senate for doing that. Yes, sir.
Any further election preps that you think need to be made, given that we have the primary coming up?
We're definitely voting. I mean, this is, they voted during the Civil War. We're going to vote. I've just stressed to Secretary Lee, and she has stressed this with the local supervisors, is, we need to be erring on the side of safety. I don't want people going into these assisted living facilities if you're not part of that community. It's just not worth the risk. That may mean some voters get inconvenienced who don't live, who aren't part of those communities. But to me, it's a no-brainer to err on the side of the safety of our residents. This is, these primaries, the way this has worked out, I mean, quite frankly, are not going to be cliffhangers. And so I want to err on the side of protecting those folks. But that's ultimately going to be decisions that the local supervisors are going to have to make. I think most of them understand that this is something that they should be doing. Okay, one more.
When will we see drive-through testing? When will we see drive-through testing?
I'll let Scott address that. I think that, I'll let Scott address that, when there may be a need for that. Obviously, if we have the Guard involved, that expands our capabilities on some of those things, but.
Yeah, thank you. First, when we have situations where, first, I want to emphasize the fact that we are rapidly increasing testing capabilities, and emphasize that if individuals need to be tested, your physician will have the ability to do the test. If you end up having situations where physician practices become overwhelmed, then we will look for these alternative measures. Thank you.
But China's response seems much more sophisticated than ours. They're having everybody go and get a fever check wherever they go. They're sending them to fever clinics. They might not
In
have-
China, you're talking about?
Yes.
Yeah. Well, China's an authoritarian country, so it's a little bit different. But I would just say, I think Scott, I think me, Jared, I think we're open to doing things that be effective. There are some of these things being done, like the nursing homes, the fever checks, and some of that. The problem is that you could be carrying the virus and not have a fever. You may not have developed symptoms yet, and so there's a whole host of things that you want to deal with. And if you're somebody that's been exposed to the virus, and maybe you contract it, you could still test negative initially, and it takes time for that positive result. So you would be self-isolating for 14 days, even if you got an early negative. And we've had people throughout the country that have had an early negative and then later had a positive between the 14-day window. But I've told Scott, I've told Jared, whatever we can do using the resources we have to help, particularly some of the local healthcare providers in the effort, we want to do it. The reason I wanted to increase testing capability is, to the extent you see a surge, which we obviously are going to prepare for, we want to be able to identify as many cases as you can in the state. What Scott and his team have done is when they identify these, they do the contact tracing, people are isolated. I think that has helped slow the spread of what we would otherwise have. It's very labor intensive, takes a lot of work, but obviously you need to have the individuals identified as being positive before you can do it. Thanks. We'll have more updates later.
Are you having